Hi everyone. So, excuse me if I'm a little stuffy. I feel like suddenly feel like I either stirred up some dust by doing something, or anyway, I just can't really breathe very well through my nose. But it is Friday, March 1st, and I am doing my 20-week update. So I will just start on Monday and go through the week and tell you how it went. This was a busy week for me. So Monday, I had school as usual, and after school, I had to drive to Brighton, which is an hour away. That's where I get my injections of progesterone so that I don't go into labor early, or to help prevent that. So I drove out there, and last time, this was my second one for this pregnancy, and as you know, I think I mentioned in my last video that at my first shot, it was the nurse that normally does them wasn't available, so they had someone come in, like a different nurse, and she brought like two other people with her, two other nurses, and they all just kind of, they didn't really know, and it wasn't like they didn't know what they were doing like horribly, or I wouldn't have let them do it, but she did it in the upper butt, and it really didn't hurt at all, and I was like, well, that wasn't so bad. So this time, the lady did it. This was the nurse that normally does it. She was there. She did it in the hip, which is where I've heard they're supposed to go anyway, and the left side here, and boy, did that hurt. Like, the actual, like, getting the shot wasn't terrible, except that it is, if any of you don't know about progesterone, it's oil, so it, like, they have to kind of push to get the, the shot. It takes a minute. It doesn't just go in and out. You have to push. So, she did the shot, and as I was, like, walking out of the office, like, it hurt. It was like someone punched me in the hip, and it was pretty sore like that just for the rest of the day, and then, like, it's been fine since, but was not a fun shot to get. And of course I will do them. Obviously I'm doing them for all the right reasons, and I will continue to get them, but I am not looking forward to next Monday. So that was all I did Monday as far as, like, anything related to this pregnancy. But one more, okay, so I'll mention this. Monday I got a call. Well, for those of you that don't know, I'm going to school. I started going to school in September after, like, my thyroid storm, and after we lost Olivia, our last baby, and I quit my job and started going to school because my job, didn't hate it, but it wasn't really getting me anywhere, and I've always wanted to go in the medical field, but I don't have, like, time necessarily to go to, like, nursing school right now. So I started going to school very close to home, and it's for medical assisting. So I'm almost done, and just found a sticker on my jeans. I will be done I'll be done with the school part March 14th. And I will be done fully April 24th. So I had gotten a call from a doctor's office in Flint that got my resume from the career services that we have at school, and they were interested in having me be at their office for an externship, which we have to do. It's a 6 weeks thing. And hold on, I think, man, this is really got a cold. Anyway, so they got so that was exciting and nerve-wracking at the same time. I'm excited. So I set up the interview for next Thursday, because this week I am, like, booked completely for, like, appointments and stuff. And I wanted time to go get a haircut, because I've been saying I'm going to do it for a while, and I just don't want to go in there looking like this. So, anyway, I made it for next Thursday. And, so anyway, that passed. And Tuesday I didn't have anything to do. I did pretty much nothing at home. It was nice. Wednesday, my husband had to take the day off because we had to drive to Detroit, and I do not like to drive that far by myself. Now, my appointment in Detroit was by Henry Ford Hospital, which is pretty much kind of like a downtown Detroit area, I think, and it's busy. That's the hospital that I was at when I had my thyroid storm this summer. This was an appointment for my thyroid. This was only because they have you come in every 6 months to be checked. And so she just like felt my neck and talked to me, and I really, really like my endocrinologist. I'm really, really happy that I found her. There's no one near us that is even remotely as good as these people that, you know, they literally saved my life this summer, and they're really good. So that appointment went well, and we talked about like antibodies, and she's going to test my antibodies, which is, you know, because I have Graves' disease, she's going to check my antibodies again, you know, further along in the pregnancy. She said as of the last check, which was when I first got pregnant, my antibodies were going down very, very slowly. They like, you know, a negative result is, of course, you would be in remission, and that would be a 0, and I'm at 0.5. So she said, really, yes, I am positive for the antibodies, but it's not like as bad as, say, like some of her patients. So made me feel better talking to her, and all my thyroid levels are still good, obviously. So we're just gonna move on. They want to see me before 6 months. They want to see me after the baby's born, like right after, like probably less than a month after, because a lot of times after the baby's born is when people's thyroid acts up again. And mine was what they said, this is their words, very serious Graves' disease. Obviously, like I said, thyroid storm, I almost died this summer. They want to make sure that I don't go back into that. So that's kind of scary to think about, but I'm not, you know, I'm good right now. So we'll work on that later. And my next blood draw for the thyroid levels is March 15th. And I will let you guys know how that turns out. Okay, so that was Wednesday. So yesterday was Thursday, and yesterday I had my second cervical length, and my mother-in-law went with me because my husband couldn't take 2 days off in a row. So we went to Ann Arbor to U of M, and that's also quite a drive. That's actually more of a drive for me than Detroit is. They said that, it was just a quick, first they did the abdominal ultrasound just to look at, since I just had my anatomy scan, they didn't want to do anything real detailed. They wanted to check the baby's heart rate since I have hyperthyroidism, and they wanted to look at the baby's, I think, bladder and kidneys is something they do frequently. And so they looked, and everything looked good with the baby. The heart rate was 146, which is what it's about the range it's been. The baby was moving a lot. She said it's a good thing it's not your anatomy scan because this baby's moving a lot. The baby's leg was up so far up, like the knee was up by the face. It was really cute. So anyway, they have, it looked good. And then they did the cervical ultrasound, and my cervix is, I think it's 4.10. And I don't know if that's millimeters or centimeters, but it's a really good length. I'm 20 weeks pregnant. That's perfect. And I was really happy with that. And the MFM that was there at the hospital came in and talked to me and said, you know, I see that you have 2 more ultrasounds scheduled for your cervix. And she's like, she was really nice. She said, I just wanted to touch base with you on like why that was, because your cervix, I have no issues. It looks great. I don't see it being an issue. But I wanted to talk to you. And I said, well, the reason is because of my loss from Emerson. It was at 22 weeks, and it was, my cervix was good at 20 weeks. And then I ended up in labor at 22 weeks, and we lost her. And we don't know if that was a cervix issue or if it was because there was an infection, because there was an infection in my amniotic fluid when they tested the placenta and everything afterwards. So, because of the unknown factor, that's why. And she's like, oh, I totally understand that. So I just wanted to see, she's like, so do you want to keep those appointments? And I said, you know, I really do. And she said that was fine. And as much as it's a pain in my ass to get to Ann Arbor every week, I just would not feel right not going next week or the week after, being that those are like critical weeks for me, as in like I lost, that something happened between 20 and 22 weeks not last time, the time before. So, so I kept my appointments, and I have another cervical length next week and the week after. and I'm not sure where we'll go from there. We might do 2 more, or we might just, if it's at 22 weeks, if everything's good, I might just say okay. But I have a feeling I'm probably going to want to go for the next 2. They're good with that, which is cool. So, hold on. I am going to go blow my nose. This is driving. All right, I'm back. So anyway, I don't know if blowing my nose helped or not, but so anyway, so today's Friday. Technically, I'm 20 weeks and however many days, but I think the baby measure is like bigger, which doesn't really matter, but I'm just going to say 20 weeks. So my symptoms, we'll just do a little bit of that, or how I've been feeling. I feel good. I feel a lot happier with this pregnancy, like more confident, but I'm not letting my guard down. And I did announce on Facebook, for those of you that are my friends, you saw that. It feels good to get it out in the open. There is no hiding this anymore. I mean, for real. So the baby moves a lot. As I said, I have an anterior placenta. It's still anterior. I don't know if that can change, but it's still there. I can still feel the baby. Sometimes it feels like it literally like jumps off my bladder, and it feels very deep and like internal. And at other times I can see my belly like vibrate where it kicks outward. So things are good with the baby and the movements and the heartbeat, and I feel good. And I don't use my heartbeat monitor nearly as much now that I can feel the baby moving. I did not use it at all yesterday. And I used it once today, and I probably won't use it again. Yeah, so I will show you my belly. Okay, this is the belly. It's a little blurry, whatever, you can see it. It's not hideable. What I did notice with this pregnancy, I am getting wider here. Now, I don't believe the old wives' tales of that the way you carry is what you're having, but this pregnancy, for sure, I am getting wider in the hip area than I have with the majority of my pregnancies, but who knows. So also my boobs are huge. Like for me, I have cleavage, as you can see, they're very full. I don't usually get that way until afterwards, or at least much closer, but honestly, I do think this baby is a girl. I have not checked, I have not like looked, I have not asked them to tell me. I've actually told them every time I go for an ultrasound, we aren't going to find out, so I don't want to know. And but there have been times when I've caught like a glimpse as they're going, and I think it looks girly, but I'm no ultrasound tech. I'm just going by what I see. And also my gut feeling is girl. My gut feeling at first was boy, and now it's very much girl, and so is my husband's, and that's fine. We don't care, and we probably won't be finding out. There's still a chance I might change my mind, but yeah. So anyway, so now I've got starting to get heartburn, starting to sleep worse at night because the baby actually will keep me up sometimes with its moving, and I'm just uncomfortable like trying to find a good position to sleep. So that's it. Like nothing really big to report as far as that goes. And the one other thing I was going to say had to do with school. So I told you earlier in this video about my extern, my interview that's supposed to be next week. And so while I was at U of M on Thursday, yesterday, I got a call from my career services guy, and he said, "Are you supposed to be at your interview today?" And I said, "No, it's Thursday, it's March 7th. I made sure that it wasn't this week. I actually asked her for a day next week because I had so much to do." And he said, "Well, you know, Patty from the office called and said that you were supposed to be here." And I was really upset by that. I was very upset, not like mad, but I mean like, oh my gosh, I'm a very responsible person. Like as far as like school goes, my grades are really good, and I don't like being viewed as irresponsible, and I really want this externship. So I was kind of upset, and he said, "Well, you know, I'm just going to call her and talk to her, and well, he told me today when I saw him at school that things are okay, and he said, it, you know, it's obviously just a mix-up. Kind of sucks that I can't, like, you know, a part of me wants to say, well, it was her that mixed it up, but of course I'm not going to do that. because that's just rude. But I can tell you with 100% certainty that it was March 7th. I have it written down on one of my papers in the car. Doesn't matter. Anyway, so I have that next week, and I have a shot on Monday, and I have my cervical ultrasound on Wednesday. So I will definitely make another video, another update video after all those appointments, probably about this time next week, and I'll let you guys know how everything's going then. So far so good, and I will talk to you guys later.